It's that time of the year again when your social media is flooded with pink ribbons. It's because October is Breast Cancer Awareness Month. Welcome, everyone. I'm Shivangi from the oDoc team, and today we will be speaking about breast cancer. In 2020, 2.3 million women globally were diagnosed with breast cancer, and 685,000 women died as a result of it. In Sri Lanka, it remains the most commonly diagnosed type of cancer, with over 3,000 new cases diagnosed every year. Despite the low incidence, men can also develop this disease. To discuss it in more depth, we have Dr. Randima Naniakara with us today. He is currently working as the consultant in cancer surgery at Colombo North Teaching Hospital in Ragama. He obtained his MBBS from Indira Gandhi Medical College, Nagpur, Masters in Surgery from University of Colombo in 2009, and the FRCS London in 2017. He has served as a consultant cancer surgeon in many parts of the country, including Jaffna, Anuradhapura, and Kandy. Dr. Naniakara has a special interest in breast diseases and breast cancer surgery. Welcome, Doctor. It's a great honor to have you with us today to discuss something which is very, very important in my opinion. Doctor, welcome.
Thank you, Shivangi. Thank you for inviting. Thank you, oDoc and Chandula, for inviting me for this very important awareness program.
Great, Doctor. Thank you. So without wasting any more time, I would like to jump straight into the questions. Also, to viewers, if you guys would like to ask Dr. Randima any question, please do send us the questions to us via the comment section below. Or if you would like to ask from a more private manner, you can DM it to oDoc, and we will, if we have time, we will ask Dr. Randima those questions. So, Doctor, the first question I have for you is, what is the significance of Breast Cancer Awareness Month?
Yeah, that's a very good question. So, breast cancer is the commonest cancer globally now. Since about 2019, before that, it was the lung cancer which is commonest. And even in Sri Lanka, it is now the commonest. Earlier, it was the oral cancers because of betel quid chewing. Now that trend is going down. But the breast cancers are gradually rising, the number. You were correct. We detect about 3,000 new cases annually in Sri Lanka. But in 2019, that's the latest unpublished data we have detected 4,600 new cases. So 2,650, something like that. So there is a bit of a jump, and there is a slight increase. And since I run a breast clinic at Ragama, I do find patients coming now more and more with breast cancers, particularly younger females, more in the sort of productive age group, sort of between 40 to 60 years.
Great, Doctor. Thank you for that information. And I didn't know about that number. So yeah, thanks for that stat.
And one more thing, Shivangi, the breast cancer, if it's detected early in the early stages, it is readily curable. And therefore, it is very important that we raise the awareness about this disease. This is another particularly important in this month.
Great. Okay, Doctor. Thank you for that. Just leading on to my second question from that. Is breast cancer, so let's say if someone in your family has it, are you also going to get it? And what are the risk factors for breast cancer?
Yeah, so only 5% of these breast cancers occur in families. That means say familial or hereditary because of a genetic mutation that's handed down from the mother or the father from your relatives. Then therefore you get about 5% of such cancers. The vast majority are sporadic, meaning to say without any associated family member, a female can develop a breast cancer, not necessarily female. About 1% of the breast cancers are male breast cancers, but majority are female. So 90 to 95% are sporadic cancers. So only 5% familial. So the next question you asked me was the risk factors. Yes, there are several identified risk factors. Some of them are modifiable and the others are not modifiable. So the importance is if you modify certain risk factors, we can actually bring down the breast cancers by about 30%. So that is the importance. So some of the non-modifiable risk factors are the female sex. You're born female, you can't do anything about it. So you have a higher risk than a male. Then the next is advancing age. So we rarely see a female under 25 having breast cancer, very, very rarely. But generally, as you age, after about 30 years, 35, 40, after your middle age, you generally develop a risk, the risk increases therefore advancing age. So a non-modifiable risk factor. The other thing is the early menarche and late menopause. So if somebody attains puberty, if a girl attains a puberty early, say about 9 years or 10 years, and then continues to be fertile up to about 50, 51, 53 years, something like that. So there's a long period of fertility. So during this period, the breast is exposed to the female hormone called estrogen. There's a continuous exposure. So that puts you at risk. So by conceiving, getting pregnant, if particularly before the age of 30, then you can break this cycle. So, so my advice is to actually, if somebody is hoping to get sort of pregnant, so have a baby before 30, that will reduce the risk. Also during breastfeeding, there is a surge in the female hormone called progesterone, also in the pregnancy as well as in breastfeeding, and the estrogen levels are down. So therefore, the breast is not continuously exposed to this hormone, estrogen. So this is the theory. So these are some of the modifiable risk factors. So taking hormones from outside, I mean, like oral contraceptive pills, particularly those containing estrogen, and having hormone replacement therapy for those who have had early menopause. So that also puts you at a risk. Now, these are modifiable risk factors. If you're on the pill, doesn't necessarily mean you're going to get breast cancer. But if you have a family history and on the pill, I think then you might increase the risk. So therefore, it's advisable to discuss with your the VOG or your family doctor, and then embark on taking these drugs, not just off the counter. Then there are other modifiable risk factors like lack of physical activity, physical inactivity, sedentary lifestyle, taking a lot of fatty food, uncontrolled diabetes, smoking, alcohol. All of these are implicated in breast cancer. So I advise everybody, both males and females, to exercise daily, at least for 30 minutes or 3 hours a week at least. So that will reduce the risk, and taking a balanced, healthy diet. So these are always important factors. And yeah, one more important thing is radiation. If you have been exposed to radiation, that also increases the risk. There are many, but these are the most important risk factors.
Thank you, doctor. Thank you for explaining those risk factors in detail. It was very helpful for me, and I'm sure it's been very helpful for the viewers also. Just you mentioned that between the ages, if someone hits puberty at a young age, there's the level of estrogen that you're exposed to, all has impacts on whether you will or will not develop breast cancer. But what are the symptoms that people should look out for so that women or men are able to prepare and because I've heard prevention is the best for treatment, right?
The most important symptom is a painless, gradually enlarging lump in one of the breasts. Very rarely we see it in both breasts, but gradually enlarging painless lump is the most important, because it's painless most of the time, and majority of the females affected are in their sort of middle age or sort of elderly age group. They don't want to bother the rest of the family. They feel a lump, but it's not painful. They don't seek medical advice. Now that's the problem. We want to detect it early. So if there is any lump in the breast, but either it's painful or painless, I think you need to get that checked out, particularly if you're above the age of 20. Under 20, I have not heard of a breast cancer under 20. So if you are above the age of 20, it's a good practice for all females who are menstruating to continue to a monthly self-breast examination. Go in front of the mirror, use your right hand to examine the left breast, use the left hand to examine the right breast and your armpits, see for any changes in the skin color, in the changes in the nipple or any. So these are sort of, and then if there is any hard area, or whether there is a nipple discharge, particularly if it's blood stain. So these are important symptoms. Blood stain nipple discharge. When it is clear, multiductal, meaning to say at multiple points from the nipple, and when it is bilateral, very unlikely to be associated with the cancer. But single or one or two ducts with blood stain nipple discharge, that can be ominous, And as I said, changes in the skin and changes in the contour, nipple inversion, they are not absolute sort of, they're not only specific for breast cancer, but these are some of the symptoms that women have to be aware of. Any lumps in the armpit, these are the important ones. Yeah. Usually breast cancers are not painful, but about 10% of them are. So if there is associated pain, it's still advisable to see see a surgeon or your family doctor.
Great. Okay. Thank you, doctor. Thank you for explaining those symptoms also. I've heard that there's so many tests that you can do to check if you do have breast cancer or not. But my question is, do we require specialized expensive tests to diagnose or to exclude breast cancer? And what are the rough prices for these tests, such as your mammograms and stuff like that?
Yeah, basically there are 3 tests that we require for diagnosis of a breast condition. There are 2 radiological tests that we do. That is an ultrasound scan, which is relatively cheap, 2,000 to 3,000 rupees for the scan, and it is available everywhere in the government and in the private sector. Private sector, even small clinics all over the country, they have scans. So there are radiologists everywhere in the country, so they can easily get an ultrasound scan. And then for females, this is for all females with any breast complaint. For females who are around 40 and above, this is not a this is not a rule, but generally we don't do mammograms in younger females. For females who are 40 and above, a mammogram is also done for to evaluate any breast complaint. So for 40 and above, we do both ultrasound and a mammogram. The mammogram in the private sector costs about 8,000 to 10,000. It's advisable to get a digital mammogram done, which gives better sort of resolution and better information than the conventional old analog mammograms. So these are the 2 main tests that we would do. In addition, we may have to do an MRI in a younger female. That costs about 25,000 to 30,000 rupees in the private sector. A few of the government institutions also have MRIs, and these are usually reserved for young females who are suspected with breast cancer, but not for all females. So these are the main investigations. And then to confirm, we do a needle test. So there are multiple needles. Usually in the past, we did something called a fine needle aspiration cytology, FNAC. But now that has been replaced by something called co-biopsy. It's a special needle that we use to take a strip of tissue from the suspected tumor or the lump. So it's a slightly large needle. The procedure is done as an outpatient test and costs something about, I would say, between 15,000 to 30,000. It can vary from hospital and from the device that is used. So it is available in the government sector as well. So these are the main tests. Usually all these tests are done as outpatients. You don't have to stay in for any of these. You come in, have this test, and go back. The biopsy test takes about a week to 2 weeks for them for the histopathologist to report back on the biopsy. Yeah.
Great. Okay. Thanks, doctor. And my next question actually stems from your answer. You mentioned that mammograms you only ask from ladies who are above 40 years old. So is it are mammograms safe? And is it painful? Is my question. And what is the reason for it to be above 40?
So mammograms are definitely safe. They save lives. So you don't have to worry about any radiation risk. Actually, it is safer than getting a chest X-ray. So this chest X-ray are dished out for, everywhere. It's very commonly requested. So this is safer than that. If you ask me about pain, most females tolerate it very well, and maybe a little bit of discomfort, and it's not an excruciating pain. But if you have a painful condition of the breast, then a mammogram may not be feasible. I mean, you may not be able to undergo a mammogram if you're having a painful breast condition like an abscess or an inflammatory condition where it is too painful to compress the breast. Then, of course, it's not possible. Then we have other alternatives if you have a suspicion of cancer. What was your other question?
What was the main reason for it to be?
So that's a very good question. So in the young female, the milk producing glands at the breast are very dense. So they don't give a very clear picture on mammogram. So the cancers, they look a little dark. I mean, they look whitish, sort of opaque on the mammogram. Even the young breast tissue also look white and opaque on the mammogram. So it might be a bit difficult to differentiate. But we might have to do a mammogram retrospectively. If we diagnose on ultrasound or on a biopsy, we might have to do a mammogram or an MRI if the mammogram is not very conclusive.
Got it, doctor. Thank you. Thank you for that answer. My next question also leads from your answer to the previous question about needle biopsies, right?
Mhm.
How much does it cost? And what exactly is a needle biopsy for like the viewers who don't know? And what's the
Yeah.
cost? And how
So
soon do you
the needle test, as I said, it's about 15 to 30,000. It depends on the device used. The cost can change, the vary, and it is done as an outpatient procedure under local anesthetic. A bit of a longish needle and a slightly large needle, but it's not painful because it's done under a local anesthetic. I do it regularly at my breast clinic in Ragama. Patients after the clinic consultation, I do the biopsy then and there. I am an assisting nurse, and we take some biopsy, and the patients go home. It's a tiny. We do the biopsy to a tiny hole that we make it we make under local anesthetic, and the report takes about a week to couple of weeks, a week to 10 days usually. But if it's really urgent, we can get it under a week, about 5 to 6 days.
Okay, Dr. Pinoman, I have another question which stemmed from like the answer you were just saying. What's the
Fine,
reason for the doctors to use general over local anesthetics just for needle biopsy?
We're not doing general. They're doing it under local anesthetic.
Under local, okay, sorry. Okay,
Yeah.
under local. Got it, okay.
So it's an outpatient thing. You come in and have it and go.
Do it and go. Okay, got it.
Yeah, the idea is actually in the developed world, they have something called the one-stop breast clinic. The lady with the breast complaint is referred by the general practitioner to the specialist breast surgeon. And this surgeon has a consultation. The patient goes for the mammogram and the scan then and there. And if there is a suspicious lesion, they have the biopsy then and there. But the result of the biopsy will take a week or two. But the consultation and the investigations are done then and there and completed. So it's a one-stop breast clinic. We are yet to establish that, hopefully in the near future in Sri Lanka for all Sri Lankan females.
Great, that sounds brilliant, doctor. Thank you for that. Are any treatments available, doctor? What are the treatment options if they are available?
Breast cancer, if diagnosed in its early stages, as I said at the very beginning, is readily curable. So yes, there are many treatment options, many retreatment options. Almost always there will be surgery for of the breast, unless it is very advanced where the breast cancer has spread to other parts of the body like bones, lungs, liver, or to the brain. So these are the common sites where the lung cancer spreads. Sorry, the breast cancer spreads. And if the breast tumor is small and there are sort of metastatic disease, we call the disease that has spread to other parts of the body, then of course there is hardly benefit for the patient having any surgery on the breast. Otherwise, almost all other stages, the patient will have surgery of the breast. Now, in the very early stages, the surgery will be the treatment option. And it'll be surgery of the breast and some surgery in the armpit as well. So we may have to remove the whole breast if the tumor is large, but now the current trend is actually breast conservation. Now, 60% of my work is 60 to 60%, 65% of the breast cancers that I do, the patients have a breast conservation, meaning to say they have a small tumor, they have a part of the breast removed, the tumor is removed with an envelope of normal breast tissue all around. So, we don't see the tumor, we just remove it with a cuff of normal tissue 3-dimensionally. And then we do a little bit of, we move the tissues in the body, like, a little bit of fat around or within the breast, within or around the breast to get a good symmetry of the breast. So this is called breast conservation. And we may have to do some surgery in the armpit as well to test whether the disease has spread to the lymph nodes. And if the lymph nodes are involved, we do something called an axillary clearance, that we remove all the lymph nodes in the armpit. So generally, this is the surgery. And when there is a need for removal of the breast, we always have the option of reconstructing the breast. It will probably not look like the other breast. It may not match 100% to the other side, but the lady will have a breast so that she can wear a bra and a sleeveless top. And some of the reconstructions come out really nice that even they can wear even a bikini. So, so there are a lot of options. And for the reconstruction, we may sometimes have to use some of the patient's body parts, like the fat or muscle from the tummy. Then the patient gets a free tummy tuck as well, and then or part of a muscle from the back. And alternatively, we can use prosthetics, which we call implants, to reconstruct breast. There are many surgical options for breast cancer, and breast cancer is no longer actually a death certificate. Actually, if you diagnose it in the early stages, it's readily curable, and I don't think you need to worry. So continuing to answer your question about treatment options, so surgery is the mainstay of treatment for early breast cancer. And then we almost always combine with other forms of treatment like radiotherapy to the breast and chemotherapy, then endocrine therapy, and some other targeted newer therapy sort of therapies that we have called targeted therapy. So about broadly 5 ways: surgery, chemotherapy, radiotherapy, endocrine therapy, that is a hormone manipulation. And because breast cancers are usually not usually, about 60 to 70%, 65% of them are hormone dependent. So we manipulate the hormone estrogen to sort of treat them, and targeted therapy. So generally about 2 to 3 of these modalities are combined for every patient.
Great, doctor. Thank you for shedding some light on all the treatment options. Because in my experience, a lot of light is shed on like symptoms and all of that, but treatment options, not much data is available, I think, freely. So that's why I wanted to ask you that question. I have one last question, but before I go to that, we've got a viewer question, which I would like to take, if that's okay.
That's fine, yeah.
This viewer has anonymously sent us a DM and asked us, is breast cancer, can it reoccur after positively treating it?
Yes. Now, it can recur locally in the breast, regionally in the armpit where the lymph nodes are, or distantly in another part of the body. Yes, there is a risk. There is the lifetime risk of it coming back. But as time goes on, this risk reduces. If you detect it in early stages, very, very early stage, let's say the tumor is about a centimeter in size in the breast and the lymph nodes are uninvolved, then the chance of cure is very high, very high. It's like, we have about 95% 5-year or about 100% 5-year survival or 10-year survival. So we have a very high sort of survival rates if we detect it very early. As the tumor grows in size, or if the lymph nodes are involved, or particularly if there are mets, then the chances of complete cure, we talk in years of survival, it diminishes.
All right, thank you for that, doctor. I think that answers this viewer's question very clearly. My last question is, what advice would you give for people who know someone who has recently been diagnosed with breast cancer, or if they themselves have been diagnosed with breast cancer, what advice would you give for managing breast cancer?
Yeah, when diagnosed with any cancer, anybody, including myself and you, would be devastated. It's not affecting just that individual, it can affect the entire family. So it's a very broad situation. It affects the patient financially, so physically, emotionally, socially, and all the family matters and all those things come into an issue. So management of a patient with breast cancer cannot be done by one individual. There we have a team of consultants combined with nurses and other therapy, physiotherapists, and all of them, psychotherapy and all that sort of psychological support and all of that involved in managing a patient. So if you are diagnosed with breast cancer and if you have an early disease, don't worry. It's going to be a bit of a rough ride initially, because you're going to have some surgery involved, maybe radiotherapy, some chemotherapy. But after about 6 to 9 months, all of that treatment will go away. You might lose your hair with chemotherapy. There might be skin discoloration with chemotherapy, but they are all temporary. Your hair is going to grow back. And there are wonderful wigs now available. I mean, they are also given free. There's there's a trust in Sri Lanka that that provides these high quality wigs for these females. So I don't think, you really have to really consider this as a death certificate or a death sentence. So this is actually a readily curable situation unless it is ignored. So that is the importance of raising this awareness. This during this entire month, we have dedicated an entire month for breast cancer awareness. So I think that this message should spread to everybody, all females particularly, and if we can detect it early, we can definitely cure it. So I think if you're diagnosed with the cancer, just hang in there. There are enough and more consultants serving all parts of this country in various fields that can help you and cure you. So I don't think you need to worry. And the most important take-home message is do monthly self breast examinations for females over 20 and above. So 20 and above. If you are menstruating, we suggest that you wait till your menstruation stops. Say if today is the first day, you examine your breast on the 7th day. So you let the menstruation finish, and then go in front of a mirror and examine your breast with the right hand. You examine the left, with the left hand, you examine the right. There are enough and more videos on YouTube and information on the internet for this. And then if there is anything that you detect, seek medical advice. And for females who have stopped menstruating, dedicate a particular day of the month, so the first of the month or the last day of the month, for this, just a few minutes in front of the mirror before or after a shower.
Thank you so much, Doctor, for all the information you've given us today. You told us certain things which I've never heard of before, and it's very, very important, like you said. And for spreading so much awareness and for everything you do, Doctor. Thank you so much. It was an absolute pleasure and honor having you with us on today's webinar.
Thank you, Shima. Thank you for inviting me.
Absolutely, Doctor. And to the viewers, if you would like to consult Dr. Randima in a more private setting, he's available on oDoc. You can consult him via the oDoc app, wherever you are and whatever time you can consult him. And I would like to once again say, as oDoc, we take a social responsibility as a healthcare provider to spread awareness, and we will continue doing that till forever, basically. So again, once again, Doctor, thank you for being there with us. And to the viewers,
thank you, Shivangi.
Thank you. And to the viewers, thank you for watching and for tuning in today. If you have any other topics that you would like us to explore in the coming webinars, please do send us a DM about it, and we will be sure to take that on board. Until I meet you guys at another webinar in maybe a few weeks, this is Shivangi signing off. Thank you and be safe, everyone.